exonerated. That's how I feel right now. This morning, I received a letter from the Board of Medical Practice stating that the board has decided to dismiss the complaint and close its investigation at this time. For the last 4 months, I have been investigated by the Board of Medical Practice for one allegation after another. I am not allowed to see my accusers. This recent dismissal was regarding me being a danger to public health because of a video I put on Facebook. My name is Scott Jensen. I'm a state senator and I'm a family doctor in Carver County. I've practiced for 35 years. I feel like one of the most investigated doctors in America. I have been investigated by the Board of Medical Practice repeatedly. I understand they have challenging work to do. I believe that people are using the Board of Medical Practice as a weapon to try to muzzle me. It isn't going to happen. I will continue to try to be authentic and honest, kind and thankful, and courageous in sharing my perspective regarding COVID-19. The fact of the matter is, USA Today also was fact-checking me a few months ago, and they came out and said that what I had to share was true. I have been investigated, criticized, and scrutinized by bureaucrats, politicians, academicians, physicians who don't agree with me, and a whole lot of other people. I don't know what to say about it. I'm just going to keep trying to do my best. I feel exonerated, and thank you to all you folks who have been so kind and supportive. But let's move on. Let's talk about immunity. In the last few days, Dr. Fauci contributed to an article in the Journal of the American Medical Association in which there was a reference to confer herd immunity on a population basis. I appreciate that reference because I think that herd immunity has come under some attack as if it's a dirty phrase. It's not. Herd immunity is not some religious belief. It is an entity. It is a phenomenon that occurs in regards to incidence and prevalence of disease. It was initially discussed in the early 1900s in the sphere of veterinary medicine and cattle. In the early 1930s, we talked about herd immunity developing in small groups of people that had heavy incidence of measles, and we didn't have any vaccinations for measles in the 1930s. This has been an epidemiologic phenomenon that we've known about and talked about for literally centuries. We might have used different terms. It's no different than gravity. Gravity is a thing. It's not a religious belief. The apple falls down, it doesn't fall up. So, I want to talk about a couple other things regarding immunity. There have been some articles about, do antibodies to COVID-19 persist, or are they waning so rapidly that people would be susceptible to another infection? Well, there was an article in October 27th, 2020, New York Times, by Apoorva Mandavili. And in that, there's a quote by Scott Hensley, an immunologist at the University of Pennsylvania, saying, some of these headlines are silly. Basically what happens is, after we get over an infection, it's natural for the antibody level to drop off, but that doesn't mean it goes away. Our immune system has the ability to remember, and so we will have a low-level circulating, if you will, group of antibodies at all times, but it won't be the level that it would have been at the time of the infection. So if we get re-exposed to something, literally within hours or a day, our immune system can ramp up the antibody level and go and attack that viral particle or whatever, if you will, invader we're dealing with. I think it's also important to realize that a lot of people that are testing negative to antibodies could still have immunity to COVID-19, particularly in regards to cellular immunity. This is an area of immunity that's more difficult to test for. It's more expensive. It's more investigational. It has to do with CD4 and CD8 cells associated with T lymphocytes, but it's a real thing. And then there's also the issue of, could we have, if you will, a disease resistance embedded within our immune system that we're not able to detect at all. So there's multiple arms of our immune system that are going to help us, but waning levels of antibodies doesn't mean that that person has lost the ability to protect themselves against a reinfection from COVID-19. I've been doing a lot of serology testing on my patients that have had COVID-19 3, 4, and 5 months ago, and I have yet to have had a patient not show IgG antibodies. I think of this gentleman, he's 85 years old, and he had severe COVID-19 requiring hospitalization in May, and he still has IgG antibodies. So I think that's important to remember. But I think this cellular immunity warrants more study, and we should pay attention to it. So when we think of immunity, let's remember antibodies, cellular immunity, some intrinsic disease resistance. These are all parts of what could be happening in our bodies, which is wonderful. In addition, I think it's important to realize that the fatality rate in hospitals when you're admitted to the hospital with COVID-19 has dropped dramatically. This is because I think physicians are teaching one another. We've learned a lot, and that's terrific. Physicians out on the East Coast have taught all of us a lot as to what works well and what might not work so well. We're getting an increasingly large, if you will, repertoire of outpatient therapies that can help people. So that's good news. So I just wanted to share some thoughts about immunity. I want to thank you for your support during my time of investigation from the Board of Medical Practice. We'll be in touch. Be well. Scott Jensen.